Hi guys, if you're just joining us, we are just about to get started. So it's Dr. Mo here from Inspire Medics. Just let us know where you're joining us from. So I can see Heather, Inar, Julia, Lay, Mohammed, Naleki, Pratik, Thor, Victor, Fadakemi. Welcome everybody. So with this getting started, we'll give it a couple of minutes so everybody can join the webinar. And we're also going to start live streaming to our Facebook group as well. So Astri, welcome. I can see a couple more people now joining. Wiam, Zelat, Shivangi. Welcome Shivangi, welcome back. Rukaya. So guys, if you don't mind, just down in the chat box, let us know where you're joining us from. And also let us know roughly what time it is. So for example, if you're in India right now, I think you're 4 to 5 hours ahead. Which part of India specifically? So for example, if you're joining us from Mumbai, and that way what we can do is a shout out for names and obviously locations, and we can start live streaming this to the Facebook group. So Vikas, I'm just going to let you take over the chat feature once I live stream this to Facebook.
Perfect. Hi guys, welcome to the iMedics monthly, every couple of weeks webinars in preparation for PLAB 1 and PLAB 2. Let's see where you're all coming from. Just give me 1 second and I will, there we go, get rid of this. Right, so the questions are coming in. Okay, so we've got Inar Suleiman from United Arab Emirates. It's 3 o'clock. Welcome. Welcome Inar. Nalaki from Leicester. Mohammed Hashi from London. Faldekimi from Lagos, Nigeria. 12 p.m. Ah, that's interesting. Astri from Jakarta, Indonesia. It's 6 p.m. here. Ah, fantastic. Keep them coming in, guys. Whereabouts in the world are you joining us from and what time is it? And I also like to ask what the weather is because it's always interesting to see some of the temperatures that we have. It's Rukia from London. It's 1 p.m. in Lebanon. Okay, fantastic. Lei Thu from Myanmar. Ifani Egbo, forgive me if we pronounce anything incorrectly, from Ferdinand in Saudi Arabia, and it's 2 o'clock at the moment. Fantastic. Welcome, guys. I can see more of you are now joining. Keep coming on. Keep coming on. We are, let us know where you're from so that we can give you that shout out. Montenario, UK, 11 o'clock. Yeah, you are correct. We are in the UK. We're in Coventry, and it is around about 2 minutes past 11 in the morning here. Victor from Canada, it's 4 a.m. here. Fantastic. Victor is one of the most committed iMedics webinar attendees. It's 4 in the morning and he's joining us for a live PLAB 1 and PLAB 2 preparation webinar. Who else have we got? We've got Al Haytham from Saudi Arabia. It's 2 o'clock. Henry Nkwolo. Henry, it's Granada from 7:20 a.m. Welcome, Henry. I think it's Henry from the PLAB 2 Academy. So welcome back, Henry. Good to see you again. Thor said it's in Myanmar. It's 5:30 p.m. here right now. Pratik Sharma from Kathmandu. Ah, fantastic, fantastic. So keep it coming in, guys. More of you are now starting to join. Whereabouts? Dr. Mo's just getting ready to stream it to the Inspire Medics PLAB 1 Facebook group, and it will, if you're in the PLAB 2 Facebook group, then obviously, you know, we can always post a link in there. We will also, anyone else wants to do a quick shout out before we get cracking? Give you 30 seconds. Oh, another message is coming. Okay, welcome all. That was from Inspire Medics. Okay, great stuff. So, Dr. Mo, I think, are you streaming to the Facebook group?
Yeah, so we're gone live to Facebook, guys. Welcome to the PLAB teaching webinar today. We're based in Coventry in the UK. It's 11 a.m. local time. A little bit rainy outside. Temperature's about 5 degrees Celsius. We're going to be teaching 2 topics today. One is going to be on Croup, which is obviously more pediatric based topic, and the other topic will be smoking cessation. You're going to learn at least 3 key points for each topic. Those learning points are going to be relevant for PLAB 1 or for PLAB 2, depending on where you are in your PLAB assessments. So what we'll do is we'll get started. We'll do a share screen and make a start. So I assume Vcash, you can see my screen. Okay, yeah. Good. So, so like we said, guys, we'll cover 4 key learning points for each topic. Obviously, we want you to learn the information. We've got, me and Dr. Sand have got 2 different teaching styles, so you'll benefit from both of those teaching styles. And we're going to spend approximately 20 minutes on each topic, and you'll have an opportunity to ask questions. So the first 15 minutes, we'll go through the latest UK guidelines for Croup. We'll then have a question and answer session. We'll talk you through some exclusive discounts for products that we have on our website, mainly the PLAB 1 mock exam, which is priced now at $19.99. It's a full-day mock with 6 hours of teaching afterwards. And then we have a PLAB 2 communication skills course, which is priced very, very competitively at $49.99. It's an advanced communication skill course, so it isn't a standard one, it's an advanced one, jam-packed with information, 9 to 5, so it's approximately 7 to 8 hours. And Dr. Sandu will include those links in the next 5 minutes in case you want to have a quick browse. And then, of course, Dr. Sandu will move on to smoking cessation. That's a really, really key topic, especially for PLAB 2, but also it's very, very relevant for PLAB 1 because the types of drugs that are used in smoking cessation often come up in the PLAB 1 exam. So, guys, we'll get started. We appreciate some of you joining us from from different time zones, and you may be leaving work, you may be at work, or you may be about to start work in a short while. So let's do a quick recap for Croup. Now, this is important because you should have learned all this information in medical school, but obviously if you haven't touched pediatrics for a long time, because perhaps you're doing an adult medicine rotation or surgical rotation, we'll give you a quick recap of how you diagnose Croup. So the key thing with Croup is this is predominantly a pediatric diagnosis caused by a viral infection, and it often occurs between the ages of 6 months to 6 years. So roughly you should have that figure in your head. Of course, you can get it in older kids, 7, 8, 9, 10, 11, 12, but the majority of diagnoses are made between 6 months and 6 years of age. The key classical feature of Croup, which you should all be aware of, is a seal-like barking cough. It's a very distinctive cough. If you haven't heard of it before, for whatever reason, go to YouTube, type in Croup cough, and you'll hear a very, very distinct cough, which once you've heard it, you'll never forget it. And you'll be able to diagnose Croup very, very quickly based on the description or by hearing the actual the cough itself. Now, it's important to know that before the seal-like barking cough starts, often there's prodromal symptoms 24 to 48 hours before the diagnosis. So often you get a cough, you can get a fever, and you can get a rhinorrhea, which is discharged from the nostrils. And then from there, you develop this barking cough. So the initial cough isn't always barking. It often occurs 2 days later. But the key thing is it's sudden onset. Suddenly the cough sounds like a normal cough, and then it becomes, after 24 to 48 hours, a seal-like barking cough. Other associated symptoms to be aware of with regards to Croup is the child can develop a hoarse voice. They can also develop stridor. So stridor is mainly inspiratory in nature, so it's due to airway obstruction. And of course, you can also develop respiratory distress, and we'll come on to that very, very shortly. So this is a recap. Again, if you're just joining us, with this recapping how you diagnose Croup in a young child, often between the age of 6 months to six years. Let's move on to the actual guidelines themselves. These are the latest NICE guidelines. NICE is, of course, the medical body which provides medical guidelines for UK doctors. And in general, most doctors will follow these guidelines. And the reason we follow these guidelines is because they're evidence-based, firstly. Secondly, if you follow the guidelines and if anything occurs medico-legally in your practice, you can say, okay, I was following the latest guidelines. This is UK national guidelines. Therefore, I followed what most doctors would have been expected to follow. And so there's no, for example, court of law can say that this doctor did something outside the normal practice of medicine in the UK. So in terms of Croup, it's broken down into 4 classifications: mild, moderate, severe, and I'll come on to impending respiratory failure. So it's important when you're assessing these patients, or if you're doing a PLAB 1 exam, that you know into which classification the Croup actually sits. So mild, moderate, severe, and of course impending respiratory failure. So with mild Croup, a diagnosis of mild Croup, you only have the seal-like bark, but you have no other features, no other red flags or moderate symptoms. So the child's relatively well, they don't have any red flag symptoms, they don't have any red flag examination findings. And for that reason, you can generally manage them in the community. And I'll come on to that in a little while. Let's talk a bit about the classifications first. Moving on to moderate croup, you have the seal-like bark, but you then also develop other symptoms, specifically stridor symptoms, and also you can develop sternal recession as well. So remember, sternal recession is to do with the sternum. The sternum gets pulled in as the child breathes, and it's a very apparent finding on examination. So that's a moderate croup. The third classification of croup is severe croup. Now, at this point, the child has a seal-like bark, they have stridor, they probably also have sternal recession, but they start to display more severe symptoms like agitation and lethargy. And you can also get intercostal recession at the same time, but it's not necessary to diagnose severe croup. So the key thing with severe croup is the child starts to become agitated and lethargic. And the reason for that is because they're starting to work hard with their breathing. They're perhaps developing lactic acid in the blood. And of course, it's causing them to become fatigued and tired. Now, from severe croup, a child can then move on into impending respiratory failure, and that's a separate classification altogether according to NICE, and I'll come on to that shortly. We'll cover it now, and then I'll bounce back into management. So with impending respiratory failure, essentially the child is probably going to go into respiratory arrest. So remember from your medical school teaching, or if you've done a pediatric rotation recently, children often have a respiratory arrest rather than a cardiac arrest first. So their breathing often gets affected first, and they stop breathing, and then a short while after that they'll go into cardiac arrest, of course, for obvious reasons. So it's important to recognize the key features of impending respiratory failure, because if you're in a hospital setting, you're gonna have to call the crash team. You're gonna have to make sure that the senior doctors are there in case you're there by yourself. But more importantly, if you're in a community setting, you need to call an ambulance immediately. So the key features of impending respiratory failure are increased sternal or intercostal recession. Remember there, you'll notice with sternal recession that it'll be quite shallow to begin with, and then it'll become deeper and deeper and deeper. You can also get asynchronous chest wall and abdominal wall movement. So if you remember from your physiology from medical school, as you breathe in, the diaphragm pulls down, the chest wall moves outwards, but the abdomen also moves outwards as well. And if there's asynchrony between those two movements that you start to notice, then of course that can start to suggest impending respiratory failure. Other features include fatigue, pallor, cyanosis, decreased levels of consciousness, and of course there's an overlap between agitation and lethargy there. Tachycardia, now remember tachycardia is age specific. So that's very important to note. So a tachycardia in a 3-month-old has a different cutoff for tachycardia in a 3-year-old. Now we have, Dr. Sandy, if you don't mind, free flashcards which the doctors can buy. So we have age-specific cutoffs in our free flashcards, and you can use that as a reference point for revision. They're free. You just need to pay for postage and packaging, and Dr. Sandy is going to include that link in the chat. And then finally, if the respiratory rate is over 70 breaths per minute, that's a red flag. It suggests impending respiratory failure. Now, why is this all relevant? Why does NICE classify croup into mild, moderate, severe, and impending respiratory failure? The reason for that is because it will determine your management. It's very important. If you're sitting the PLAB 2 exam and you have a child who, for example, has croup-like symptoms, you want to classify them. You want to verbalize to the parent. Mary, so if the mother's name is Mary, it seems that Hannah has mild croup. What that means is she has a viral infection, which is predominantly is featured by having a seal-like bark, but she has no other red flag symptoms or any worrying symptoms, and therefore we classify that into mild croup. Does that make sense? And so the treatment of mild croup is essentially community care. You generally, we'll come on to this, you generally reassure the patient, you provide any treatment that's necessary, we'll come on to this, of course, and you safety net. However, NICE are very clear. If the child has moderate, severe, or impending respiratory failure, that child needs to be admitted to hospital, full stop. So if you're in a community setting, you admit them, but if they're already in hospital, of course, you treat them in a hospital setting, but the child is getting admitted rather than discharged with a safety net. So that's the second key learning point. First key learning point is how you classify croup. Second key learning point is how you manage croup. Now, what is the actual management for croup itself? So if you are treating a child who has a mild croup illness, Again, going back to the classification, you generally go ahead and treat them with oral dexamethasone with a dose of 0.15 milligrams per kilogram. So it's weight dependent, the steroid treatment. It's a one-off dose, you give it once and that's it. Of course, in the UK, we sometimes use prednisolone, and the dosage for prednisolone, you can get soluble prednisolone, so the water turns pink when the parents dissolve it, is between 1 milligrams per kilogram to 2 milligrams per kilogram, depending on the weight of the child. And that's for mild illness. So let's say Dr. Mo on a Monday morning saw a presentation of mild croup in a child who was 10 kilograms. Let's say he was 1 year old, for example. I would give that child 10 milligrams of soluble prednisolone. The parent would administer it once, and that would be the treatment. And essentially, I would safety net, and I'll come on to that shortly. However, with as we explained, with moderate and severe croup and impending respiratory failure, you are going to admit the patient, but whilst you're waiting to admit the patient, you can go ahead and start steroid treatment or treatment of some shape, some form, whilst your seniors are arriving onto the ward, for example. So the three treatments that NICE recommend is, again, oral dexamethasone at a dose of 0.15 milligrams per kilogram. You can also, if the child is unable to swallow, you can prescribe them inhaled budesonide, and in this case, it's 2 milligram as a nebulized dosage. Or if that's still going to be tricky for whatever reason, you can also give the child intramuscular dexamethasone. That will probably be for children who are really struggling to actually get anything into their airways. And the dose there will be 0.6 milligrams per kilogram as a single dose. So if you're in a community setting, in a GP setting, you would give that treatment. But again, if you're in a hospital setting, you give that treatment whilst waiting for the seniors to review. And of course, you would do your A, B, C, D, E assessment if the child is starting to head towards impending respiratory failure. So that's the treatment in terms of the classification. Very important to understand the classification, which allows you to go ahead and choose the correct management. This is relevant for PLAB 1 because they'll be assessing if you understand the treatment, but also relevant for PLAB 2 because the examiners will be seeing whether or not you understand the classification, and from there, the management. For a child who's going to be diagnosed with mild croup, you do need to counsel the parents on the safety net, and of course, things that they need to look out for. So for the parents, you would usually say a couple of things. This is what would be considered good medical practice for a PLAB 2 scenario. You would explain to the parents that croup is generally a self-limiting illness because it's a viral illness. Most of the symptoms will usually resolve within 48 hours. And then to control any fever or pain-like symptoms, they can, of course, use paracetamol or ibuprofen, as long as there are no contraindications or the child has no allergies to them. However, if there's any deterioration in the child, whether it's the symptoms or the way they're looking, then they need to seek urgent medical advice. Now, a very good doctor would also red flag for the, safety net for the red flags as well. So if you notice the child is working hard with their breathing, if they become lethargic, drowsy, if their lips go blue, if their hands go blue, this suggests that they are becoming more unwell, and you should seek urgent medical attention. In this case, 999, an ambulance. So again, a good doctor would specifically safety net for specific red flags. So just to recap, everybody, there are 3 or 4 key learning things that we learned today about croup, which is relevant for PLAB 1, PLAB 2. One is that we did a recap on how you diagnose. Number 2, we broke down the classifications into mild, moderate, severe, and impending respiratory failure. Number 3, we talked a bit about how you would manage the child based on the classification. And finally, number 4, what would a safety net or counseling on mild croup look like? Which is obviously very important for PLAB 2 if that scenario appears. And it could be a telephone scenario. Most likely, it probably will be a telephone scenario, but it can also be a face-to-face station as well. So guys, what we're going to do with this, going to allow you to have the opportunity to ask us any questions about croup before we move on to smoking cessation. Smoking cessation is a very, very hot topic because obviously you can counsel like on most patients that you see who have chronic disease who are smokers. So that's going to be, do stick around for that. But what we're going to do there is a Q&A button in the bottom of Zoom. If you press it, it comes up with a box where you can type in the questions and then we can answer those questions. But in the meantime, what we're going to do is we're going to bounce into a screen share for the website. So quick show of hands. How many people are sitting the PLAB 1 exam in the next 3 to 4 months? There's a button on Zoom which allows you to raise your hands. Raise your hands if you're sitting the PLAB 1 exam in the next 3 to 4 months. So we can see 1, 2, three people. So only 3 people are sitting the PLAB 1 exam in the next 3 to 4 months. 4, 5. So 5 people are sitting the PLAB 1 exam in the next 6 people are sitting the PLAB 1 exam in the next 3 to 4 months. Okay, fine. You can lower your hands, guys. VCAS, if you don't mind, you can lower your hands your side, I think, as well. Okay, guys, for those of you who are sitting the PLAB 1 exam in the next 3 to 4 months, we would highly recommend, I mean, you've already got access to our free PLAB 1 exam question bank. It's got almost 3,000 questions. It's completely free. It's got a search feature in it. It's got a gamification in it, so you can see where you rank internationally. It's also got a review feature, so you can review your questions. But if you really want to boost your PLAB 1 score, like you want to learn the hot topics and the latest nice guidelines, join our PLAB 1 mock. It's 3 hours for the actual mock itself. We take a 1 hour lunch break, and then we give you 6 hours of intense learning with the latest nice guidelines on all the hot topics that are likely to come up in the exam. Anatomy, ethical questions, GMC related questions, cardiology questions, pediatric questions, you name it. The exam will be very, very representative, this mock of the real exam. It's only priced at $19.99, so it's super, super affordable. And there are 3 dates you can book into: the 7th of February, the 9th of May, and the 1st of August. This is all now next year. So if you have those dates off and your PLAB exam is coming up, or you're looking to sit the PLAB exam, book into it. There's currently a promotion on the website of a 50% discount. Normally it's priced at £40. So what I would do is right now book into it and reserve your space, because then we'll send you a Zoom link. Second thing is, so guys, highly recommend. You will learn so much for £20. It's unbelievable value. For PLAB 2, quick show of hands, who's going to be sitting the PLAB 2 exam in the next 3 to 6 months? Just raise your hands. So 4, 5, 6, 9, 10, 11, 12, 13, 15. PLAB 2 exam, guys, raise your hands. 15. Okay, just lower your hands. Guys, if you are sitting the PLAB 2 exam, I cannot stress enough how much you need to focus on communication skills, because if you keep focus on communication skills, it will lift your marks for data gathering, it will lift your marks for management, and it will also lift your marks for the entire consultation, because you will finish it on time. And at £50, we have an advanced communication skills course. We have a limited time sale price on this of 33% off. We have £25 off, and we have 3 dates. One's is next month, 10th of January. The other one is the 4th of April, and the third one is the 4th of July. Get yourself booked into this PLAB 2 communication skills course, which is an advanced communication skills course. We don't talk about stuff like, oh yeah, eye contact and making sure you have open body language. That's like standard communication skills course. We target specifically advanced communication skills, skills like how to deal with an angry patient, how to deal with a ethical situation, and how to break bad news to score the highest marks. And we give you a system. We actually give you a system which you can memorize, so you can recognize on the day which type of station you have and which communication skill to use. It's a full day course. It's from 10 a.m. UK GMT time to 5 p.m. UK GMT time. And guys, it's only £49.99. Some of the academies are like £350, £400, £500. For a full day course with me and Dr. Sandhu, where we'll teach you 10 years, well, effectively 20 years, because I've been a doctor for 10 years, Dr. Sandhu being a doctor for 10 years, 20 years of advanced communication skills course condensed into like 6-7 hours. It's amazing value, and would recommend if you subscribe to it tonight. So Dr. Sandhu is going to include the link in the chat box. Sign up to it today, because you will learn so much on this. And then the third thing is, for those of you who are struggling, like you've got PLAB 2 coming up and you really are nervous and you feel like you need one-to-one coaching, me and Dr. Sandhu will actually provide one-to-one coaching for the PLAB 2 exam. We do online mocks. This is a lot more expensive than the communication skills course. So for example, the communication skills course is only £50 and it's a whole day course. But if you want that one-to-one coaching with one-to-one personalized feedback, you can book into a 2 or a 3 hour session, and we will give you one-to-one feedback. We'll stop you in the mock, for example, and tell you where you're doing things right and where you need to improve. And those candidates who tend to come onto the PLAB 2 coaching, what we notice is, for example, if their score was, let's say, 120, before they sat their exam once and they failed it, they'll often go to a score of, let's say, 150, 160 after the coaching. So if you need that big boost because your exam is really close, go for the PLAB 2 coaching. We've had lots of candidates go through us for the PLAB 2 mocks. So that's the 3 products: the PLAB 1 mock, the PLAB 2 communication skills course and advanced communication skills, and the PLAB 2 coaching, which is a one-to-one session, which is online. So this is going to jump out of the screen share. We have a couple of questions. Okay, from Pratik. We have a question here, which is specific management of severe croup after hospital admission. Okay, so Pratik, there are a couple of specific things. Obviously, 100% oxygen, 15 liters via non-rebreathable mask. Usually the child is started on steroids. The pediatricians may start oral steroids once inhaled, IV steroids or IM steroids or oral steroids have been given. The senior management team, the senior doctors will review that patient and stabilize that patient. And in a worst case scenario, the patient may need to be intubated if they're starting to head towards impending respiratory arrest. So you wouldn't expect that to be a scenario in PLAB 2 or a PLAB 1 question, but it's good to be aware of it in terms of management. Shazia has asked a question, will it be recorded or live? Okay, so Shazia, the Advanced PLAB 2 Communication Skills course will be a live course. It will not be recorded. We've had issues, unfortunately, with plagiarism in the past, where courses have been recorded and distributed online, and we have lost a significant amount of revenue as a result of that. What we hope is your ethical doctors, you know, at the end of the day, it's $49.99. It does not cost a lot. If we charge, let's say, £400 or £300 or £100, then fair enough. And the way, so Shazia, what we do is we will give you a system within the actual course itself. So you'll have like a system you can write down. And then once you've written that system down, you can go back and revise it. We have a system that no other academy has. We've formulated this system, me and Dr. Sandhu, over the last 12 to 18 months based on 20 years of knowledge and passing medical licensing exams in the UK. And we will give you that system. So once you know the system, you can practice it. And of course, you can pass the PLAB 2 exam. That's what everyone wants to do. You want to pass the PLAB 1, PLAB 2 first time. And that's what we'll teach you to do. Okay, guys, we're going to move on to smoking cessation. Over to, Weam's got a question. How many days off school do I give the child? So Weam, if the child has mild croup, there's no need to advise time off school. The government guidelines are very clear. Like with gastroenteritis, it's different. If the child has gastroenteritis, you recommend 48 hours off school after resolution of symptoms. With croup, you don't have to recommend time off school, but if the parent says my child is unwell, they have a fever, you may recommend 24 hours, possibly 48 hours until their symptoms improve, and then of course the child can go back to school. Shazia says, I am weak in management. How do I go about asking questions? I forget. Shazia, please sign up to our PLAB 2 Advanced Communication Skills course. You will, there's lots of things that we cover, and we will provide you a system for how you approach management for different cases, SIMMAN, ethical cases, history taking cases, result stations. There's a lot of value in that course. And if you're very nervous and your exam's very close, then please go for the one-to-one mocks, because we'll teach you a lot within that. Okay. You're very welcome, Weam. Please join us for the PLAB 1 mock or the PLAB 2 communication skills course. Okay, Dr. Sandhu, over to you. I'll make you a host, so you, of course, you can sign up to, you can share the screen.
Thank you very much. Yeah, so just while Dr. Mo does that, so you can actually see in the chat, there's Mahmoud Hashi, who's written about the PLAB 2 communication course. It was very helpful one-day course. I attended it a couple of weeks ago. So I think Mahmoud was part of the batch who joined us at the most recent PLAB 2 communication skills course. There is some live role play there as well. You do get the opportunity to do some real cases. We have updated it in line with the current changes with the coronavirus, because as you know, the PLAB 2 exam has changed. And we put it at £50 because it's very cheap, and we wanted to make it accessible to as many of you doctors as we could. So do take that out and have a look. But let's move on to your smoking cessation presentation. So this is a hot topic, guys. So smoking cessation is a hot topic in PLAB 2. You're going to be heavily tested on this in your communication skills. It's a counselling station. It's also relevant to those of you preparing for PLAB 1, because you get some clinical questions based on smoking cessation. It kind of overlaps with respiratory medicine and pharmacology as well. So it's got two elements of your kind of preparation for your PLAB 1 exam. So let's get started. We're going to talk about what smoking cessation is. So we need to know what it is. What are the key things that we should be doing in our history taking for our PLAB 2 exam? And what is the current types of treatment? Again, that's relevant for you if you're preparing for PLAB 2, and of course, if you're preparing for PLAB 1. So smoking cessation essentially is defined as, the nice definition is it's a range of different activities that will aim to support people as they go about trying to stop smoking. So range of activities from behavioral, lifestyle to medical things that we can do to help somebody stop smoking. In terms of the history, so what you're supposed to be doing, so key things. Firstly, in terms of your weekly clinics and regular clinics that you do, the NICE guidance recommends that you opportunistically ask people if they smoke during a consultation. If they say yes, we can give them what we call VBA, which is very brief advice, which is, Mrs. Smith, by the way, do you smoke at all? Yes, I do. Oh, okay. Did you know that we've got a very good stop smoking service here at the surgery? Oh, no, I wasn't aware of that. Yeah, there's lots of things that we can do, Mrs. Smith. For example, we've got patches, we've got medications, we've got inhalers, and we've got behavioral treatments that we can try. What are your thoughts on this? And so you're passing it back to Mrs. Smith, and then she can be like, oh, I didn't know about that. Can you tell me more? And then you can start delving into quite a solid PLAB 2 history. Of course, once you find out that they want to give up smoking, you want to find out how much do they actually smoke. So how long have you smoked for? And what do you smoke? Is it cigarettes? Is it roll-ups? Is it, cannabis or various other things? Then we want to know about previous attempts. So have you tried to stop smoking before? And what happened last time, Mrs. Smith? And what things did you try? Now, Mrs. Smith might tell us that actually I did try to stop smoking, but then I couldn't because at work, there's 3 other people that smoke and we go on smoking breaks. And also my husband smokes as well. So we tend to smoke at home. So you've got 2 barriers that she's identified. One is that people at work are smoking, and 2, her husband smokes at home. So we can talk about, have you thought about joining as a group? Perhaps all 3 of you can try and join our stop smoking service. Maybe we should make a joint appointment with you and your husband and we can go into more detail. And that's a sensible way of counselling through that station. Social history is very important, as we touched on. So who smokes at home? What do they do for a living? And what do they do for recreation? So this is very important. So because we can use what they do for recreation in our management plan later on. So they might tell you that they don't do anything, which is not good, but we know then we can counsel them on regular lifestyle changes like regular exercise. Mrs. Smith, have you thought about going for a walk, maybe going, 1 mile a day, and then gradually build it up to 2 miles? That would be a good way for you to relieve stress, and it will help reduce your cravings as well as helping you to get fit at the same time. What are your thoughts on trying that, Mrs. Smith? So you're going down this shared management plan with your patient, but you're trying to incorporate what she says in her history into her management plan later on as part of your stop smoking counselling station. What kind of things should we be doing, guys? So smoking cessation management. So what should we be, what's the current guidance in the UK? So it's very important when you're preparing for PLAB that you're familiar with the up-to-date guidance. The guidance for the in the UK changes regularly. We update our PLAB 1 question bank regularly, and we're doing some more updates at the moment to make it in line with the current guidance. And our PLAB 2 communication courses and our one-to-one PLAB 2 Skype is all done in line with the current NICE guidance. So we make sure that you're going up to date. Otherwise, get caught out if you start sharing information which is out of date. So firstly, we need to know who the high-risk groups are. So the key high-risk groups to be mindful of are pregnant women. They should not be smoking, full stop. Mothers of young children, especially those who are breastfeeding, and of course, young people who are aged between 12 and 17. So pregnant women and mothers of breastfeeding children are very important because obviously not only are they detrimental to themselves, but smoking is detrimental to the baby or the fetus or the child. And young people are included on the list because smoking is very addictive, and the likelihood is if you start smoking at a young age, you're likely to carry on into adulthood. It's going to be harder for you to stop, and you're going to do more cumulative damage to the heart and the lungs over a period of 10, 15, 20 years. So in summary, what treatment options do you have? So you have what we call local NHS stop smoking services, or we call them smoking cessation clinics. And the key thing here is that you can offer something called carbon. So CO is carbon monoxide. Carbon monoxide is the poisonous gas, which is released from cigarettes, and it travels through the bloodstream, and it causes a lot of damage, especially over a period of years. So the stop smoking clinics, which are done in most GP surgeries in the UK, as well as in the hospital, is normally a trained nurse, and she will take a small sample of blood from the finger, and she'll measure the carbon monoxide level on the machine. Normally it'll be quite high, and then you will use that throughout the stop smoking program. So you can see how that carbon monoxide falls as the patient starts to follow your treatment. And that's reassuring for patients. It gives them a marker in their brain to be like, well, actually, I can see the poisonous gases going down because I'm following the advice that I've been given. Part of your management plan obviously should include practical advice. So things like regular exercise, whether that's running, cycling, walking, jogging, bikes, a sport that they may play, having certain things. So a golden goose tip for you guys would be something called the smoke-free app. So if you don't know this, you know, you won't know it, but if you're like us, we are UK doctors, UK practicing GPs. The smoke-free app, if you said that in the PLAB 2 exam, the examiner will look at you and say, right, this guy or this girl knows what he or she is talking about, because they've known about something which I wouldn't expect them to know because they've trained abroad. So Smoke-Free app is an app which the patient can download, and it's got lots of practical advice that they can use and self-help guidance to help them stick to their stop smoking routine. There's obviously the advice that really we should pick a start date and then aim to stop. So stop during that start date. So you might say to the patient, Mrs. Smith, how about the 1st of January? Yeah, let's pencil the 1st of January in. That's going to be our stop date. And then, of course, you've got your options. So you've got your nicotine replacement therapy, which we'll talk about in the next slide. And you've got your 2 medications that you need to know of, varenicline or bupropion. And obviously, you can use a combination. So you can use the medication varenicline with nicotine replacement therapy, which actually, if you look at the evidence, it says that it seems to be more effective when you combine them 2 together. You should then review the patient 2 weeks after they've stopped smoking, and their carbon monoxide level is measured at 4 weeks. And then after that, they get regular follow-up with the nurse until they feel ready to kind of, you know, be released from the program because they're now no longer having the cravings. So nicotine replacement therapy. So what is it? Firstly, you've got what we call long-acting forms, such as nicotine patches that patients stick on their body, and they give you a steady supply of nicotine. You can also get fast-acting versions, and they can help with people who have those cravings. And what normally happens, so this is important for you to know, because if the patient says, oh, doctor, how long do I have to wear the patches for? Well, you say, Mrs. Smith, the patches are normally applied for 16 hours, unless we give you the one that's applied for 24 hours, and you leave it on for the day before you take it off and replace it with the next one. Does that make sense so far? So you're coming up with a shared management plan. She's asking you a question, you're showing your knowledge, and you're showing your communication skills at the same time. As I said earlier, the 24-hour patch is said to be more helpful for people who like to have a cigarette first thing in the morning. So when they wake up, they get this urge to smoke. Give them a 24-hour patch. It will be much better for them, because when they wake up in the morning, they'll have still had that nicotine patch effective, which is hopefully going to reduce their craving. Now, of course, the guidance also says you are allowed to use a combination of nicotine replacement products, for example, patches, lozenges, chewing gums, and so forth. And so, you know, that's something which, if it works for the patient, we're allowed to do. The 2 medications, so the key things to remember, you don't need to know everything, just the hot stuff we teach you so that you keep your revision focused. Varenicline is a medication that you give to the patient. It normally needs to be started 7 to 14 days before that target stop date. It's a 12-week treatment course, and we counsel them. So we stop it. We say, Mrs. Smith, varenicline is a very good drug, but there are some very rare side effects. If you find that you start having problems with your mood, you feel very low, you start to notice severe problems with your sleep, such as nightmares, or any problems, any of the new symptoms that you're worried about, stop the medication and get in touch with me and the clinic. Does that make sense? So that's your way of showing your knowledge and counseling the patient at the same time. A couple of contraindications, there's always big lists, but really varenicline is contraindicated for patients under the age of 18 and with those who've got end-stage renal failure. That's what the ESRF is, end-stage renal failure. For bupropion, again, I don't want you to learn everything, just learn the relevant stuff. Bupropion, again, needs to be started around about 7 to 14 days before the target stop date. And the subtle difference is the treatment lasts between 7 and 9 weeks. The contraindication, so we can't give it to people who've got seizures, a central nervous system tumor, a history of or even current bulimia or anorexia, a history of bipolar disorder, or severe hepatic cirrhosis. So they are the kind of 5 things that you should be mindful of, probably more relevant to PLAB 1, but useful to know for PLAB 2 in the case if you had an epileptic who comes into your PLAB 2 station and wants to give up smoking, you might find that actually you're supposed to give them this drug rather than this one, and you could automatically fail the station because you completely forgot that bupropion shouldn't be given to someone with seizures. In terms of the measurements, so we need to measure the carbon monoxide level at 4 weeks after they've stopped smoking, and a level of 10 or less suggests that the person has now is following the treatment. The carbon monoxide level is reducing, and they're essentially now a non-smoker, which is great for patients. It's a good marker. They feel very satisfied because not only do they feel better, but you're actually proving to them, look, guys, your dangerous gas in your body is starting to come down. Hot topic, so what about e-cigarettes? Don't be surprised if someone asks you about this. So e-cigarettes have become very popular over the last few years. They are relatively new, but the NICE guidance in England and in the UK in general does offer some advice on this. So e-cigarettes, really, some patients will say to you, well, doctor, look, why don't I just use e-cigarettes? Now, really, we should still refer these people to the stop smoking services. And the reason for that is because e-cigarettes are quite new. We don't really know what the long-term effects are of these products. We know that, yes, they have less nicotine in than a full-blown cigarette, but the ultimate fact is they've still got some nicotine in, there's still some addiction, and there's still going to be some damage to the heart and the lungs. You still have a risk of COPD, strokes, and myocardial infarctions, and so forth. So the NICE guidance is very specific. It says, look, suggest people with e-cigarettes should stop smoking, and they should try and do it, using a stop smoking service. But you can consider using e-cigarettes as a way of stopping smoking to help people who've previously tried to stop smoking using the other methods that we've discussed. But we have to use our clinical judgment. So e-cigarettes are almost like your last opportunity. You've tried everything, hasn't worked, right? Okay, try the e-cigarettes because at least it's got less nicotine in than what you were using before. What if the patient says, I'm not ready to stop smoking yet, doctor? And that does happen. That's very common. People have been smoking all their lives. They're quite addicted to it. It's part of their behavioral pattern and their routine. And sometimes they will tell you, listen, I'm not ready to stop smoking. So we just have to be mindful that, I will move myself away from there. We have to be mindful that you've got this concept of harm reduction. So if the patient says to you, listen, I don't want to stop smoking yet, then NICE says offer them what we call harm reduction advice, which basically means that, look, I respect the fact that you're still smoking, and I respect the fact that you don't want to have treatment at the moment, but just be mindful that we do have a very good stop smoking service here at the surgery, and there's lots of things that we can offer now. For example, there's nicotine patches, there's gums, there's lozenges, there's inhalers, as well as medication that we can use. And if you do change your mind, just get in touch with us. That's a sensible thing. And of course, you can also say, by the way, have you thought about cutting down? I know you said you smoke 20 cigarettes a day. How about if you cut down to 15 for the next week, and then maybe try and reduce to 10, and just see how you feel and gradually start to wean it down. Then you can, of course, also say, why don't you try doing that with a little bit of nicotine replacement therapy? It won't do you any harm. It's only a patch. It's only a chewing gum. Stopping smoking for a period of time. So they might say, listen, why don't you take a week off, like a fast for a week with no smoking. So be mindful of that. And of course, you can use nicotine replacement therapy as well in between if the patient finds that actually I can actually stop smoking. You occasionally get some social smokers. So it's just to be mindful that there's a harm reduction strategy that you can use for someone who's not ready to commit to the stop smoking service. Pregnancy and breastfeeding women. So basically, if someone is pregnant or breastfeeding, then remember they should be referred to the local stop smoking services. We have to tell them about the risks that not only to themselves, but to their baby. There's a risk of damage to the fetus and abnormalities, an increased risk of medical problems later in life. But the key thing to remember, guys, is you can give them nicotine replacement therapy, for example, the patches, the chewing gum, the lozenges, but you cannot give varenicline or bupropion medication. These are contraindicated in pregnant or breastfeeding women or young people under the age of 18. Generally, you should avoid giving these, okay? Good, so that leads us on to the questions. Obviously, you probably have seen iMedics on social media. If you haven't, make sure you have a look at our YouTube channel. It's got lots of new revision videos that have gone up in recent weeks, and more will be going up based on the current NICE guidance, short and snazzy videos for PLAB 1 and PLAB 2, as well as other medical exams in the UK. Do have a look at our Instagram page, inspire_medics, for revision cards and slide swipe revision cards that you can use from the current NICE guidance. The Facebook PLAB 1 exam preparation group and the Facebook PLAB 2 exam preparation group are for you guys, with videos, revision cards, and a chance to ask questions. Of course, Twitter, inspire_medics, is also very useful. All the links are in the chat. If you're preparing to come to the UK, we have regular articles and updates about what's happening in the UK, as well as some revision on there. And of course, if you're using LinkedIn, then Inspire Medics Limited is also worth checking. So that takes us off there. I'll get rid of that. Good. Any questions that have stemmed up or anything that we've noticed? Okay, so Dr. Mo's troubleshooting. While he's doing that, I'll just show you our revision resources. Obviously, that's your PLAB 2 communication course. The next date is the 10th of January. We've got some on the 4th of April and 4th of July. It will be me and Dr. Mo. It will be a live course, so do join that. Now, there are other things that you can use. There's lots of free stuff on our website. Have a look at the doctor's blog. If you go onto the blog section on the website and go onto PLAB, if you click PLAB, you will come across lots of things that you can help. For example, if you're applying for a UK Tier 2 visa, we've got a good blog article on this. Lots of things that are relevant, making a CV for the NHS. Let's take you to page 6. There's hundreds of articles that we've uploaded. Here we go. So this is your PLAB 2 stuff, okay? So how to examine the testicle, a lump examination for the OSCE. Let's take that as an example. And I'm just going to open it up for you. So our team have designed it to make it nice and easy to follow. So look, introduce, greet the patient, easy to follow. Okay, we've put some color in there. We've put emojis in there. We've made it easy for you guys so you can use this for your PLAB 2 revision. It's free. It's on the iMedics website. Whatever you do, don't miss these opportunities. All of this has been made for you guys. And there's hundreds of articles like this. So you'll find, you know, if I scroll back, you'll find lots of things: thyroid exam, cerebellar exam, shoulder exam, Glasgow Coma Scale. The list is endless. There are also other relevant blogs. If you click patient information, you can see different conditions like psoriasis, post-hepatic neuralgia, pityriasis vesicular, pilonidal sinus disease. Let's take pityriasis rosacea, and again, look, easy to follow. This is good for your explanations for PLAB 2, because remember, you have to keep it nice and simple. And so these are leaflets that you can give to patients. That's who they were designed for. But for doctors, they are good for your revision, because what you're trying to do is convey medical information in simple language. That's how you pass the PLAB 2. That's how you pass the GP exams, the MRCP, the MRCS, the MRC Psychiatry, the MRC Peds, all of the exams in the UK with solid communication skills. So use these. These are available at the top here. Dr. Mo's already told you about the mock. The Inspire Medics Instagram page is this one. It's inspire_medics. It will have revision cards. Here's one on Meniere's disease. Easy to follow, what the definition is, what the causes are, how we diagnose it, and how we manage the condition. And this is all from the current NICE guidance. So it's up to date, and it keeps going: alopecia, endometriosis, cervical screening, whooping cough, cataracts, lots of things on there. So don't miss the opportunity to use that for your revision. This is the Inspire Medics Twitter page at inspire_medics. We'll keep you up to date with what's happening in the UK. We're obviously up to date with our webinars. You'll also see lots of revision material on here. So use it for your advantage. Lots of things that iMedics are producing to help you guys pass PLAB 1 and pass PLAB 2 and safely get to the UK. And we can obviously help you when you get to the UK as well. the last couple of things to look at. PLAB 1 mock we've touched on already. The other thing to be mindful of is if you're planning on moving to the UK, you can also take part of our UK visa service. So we've got lawyers that we work with, and they can help support you with your visa when you're coming to the UK. These are not actually our costs, these are the legal costs. So these are the costs that you have to pay anyway. So, but what we're just saying to you guys is that this is just a table that we've produced. And this is how most people get to the UK. They normally will go through a solicitor. These are the fees of our legal partners, but we can get you connected and get you the support that you need. Your PLAB 2 exam preparation group looks a bit like this. It will have a banner like this, and it will look like this. And we will add the links for you in the thing below.
So whilst Dr. Sandu's doing that, he's got a couple of questions. I just want to highlight a few features on the free exam question bank, because some of you aren't aware of this. Let's say you're on the exam question bank for PLAB 1 and your week topic is diabetes. So if you type in diabetes, you'll get a drop down with some options. So let's say you want to work on type 2 diabetes. So you click on that, the system will pull out all the questions related to diabetes. And if you select all and press start, then all the questions you'll see will be on type 2 diabetes. So that's a very powerful way of revising for specific topics. And you can see there's 51 questions on type 2 diabetes. Second thing is the score tracker feature. You can use this to see how you're scoring, so on different days and in different topics. Green is you're doing well, so more than 70%. Red means you're it's under 70%, which means you need to work on it a bit more. Blue means you haven't tried it. And if you have any weak areas, the system will tell you what your weaknesses are. So for example, my weakness here is Helicobacter pylori. If I click on this, the system will automatically pull out all the questions related to H. pylori, and then I can practice those questions. So there's 4 questions so far in the system. Second thing is the game mode. This is the international PLAB 1 global ranking score for the PLAB 1 question bank. It shows you the top 20 doctors in the world, and then it shows you your score. So you can see Dr. Mo's down at the bottom because he's only answered 2 questions, and I'm currently in the DNAR league. So there's different leagues you can go into depending on what your score is. And if you hover over this button, it tells you how the score is calculated. Finally, there's the filter button. We are making this feature much more adaptive, so you can start filtering based on subject areas, and also you can filter based on category. But at the moment, it gives you filters for correct and incorrect answers for the questions you've done. So if I've got a correct answer here, lactation amenorrhea, if I click on it, it'll show me the answer I chose with the feedback. So something to be aware of for the question bank. A lot of people aren't aware of these features. So Vikas, you've got a few questions then in the...
So just having a look at them. So what about those who've relapsed despite smoke? So Victor's got a question. So what about those who've relapsed despite smoking cessation programs / medication? So the key thing is you keep on encouraging them, because it's quite normal for people who are addicted to something, whether it's smoking, alcohol or drugs, to have a relapse. That's possibly, well, not possibly, it's a known cycle that they go through. So the key thing is when they relapse, we try and encourage them to get back on the path. So say, okay, look, I know that you've relapsed. Talk me through what happened. What triggered off the relapse? What did you do? There might be certain behavioral patterns that we can then work on. And we get them back in and we encourage them to go back down that route. Monday's question, does the CAGE questionnaire apply in smoking cessation? So those of you who know what the CAGE questionnaire is, C for cutting down, it's basically linked with alcohol. So have you thought about cutting down? Does your alcohol consumption annoy you? Do you feel guilty about it? And do you need to have an eye opener? So have an alcoholic drink in the morning to steady your nerves. That suggests that somebody's addicted. You can't use CAGE. You can try and use CAGE, I suppose. It's not designed for smoking cessation, but if it gives you a framework in your head, then you can. Have you thought about cutting down smoking? Does it annoy you that you smoke? Do you feel guilty about smoking? Do you need to have a cigarette in the morning? But realistically, I mean, it's not specifically for smoking cessation. Ifanye, how do you give a summarized smoking cessation advice in a non-counseling station? Good question. So what I've just pitched to you here, that would be your 8-minute station in PLAB 2. If you did not have that, you don't have to go into all of that detail. If the station is about chest pain, if the station is about something else, you can say, by the way, Mrs. Smith, do you smoke at all? Yes, I do. Okay. I know that we've talked about your pain today, but have you thought about stopping smoking? Yes, I have, doctor. Okay, great. Well, we've got a great stop smoking service. Would you be interested if I gave you the details for this? Yes, doctor, please give it to me and I'll have a think. Okay, great, Mrs. Smith. I'll get the information ready for you. And perhaps we can book a follow-up in the next couple of weeks to have a chat about what you've decided. And that's it. You leave it there, 30 seconds, and you've finished it off. You don't have to go into all the detail about the different options because you remember it's not a smoking cessation station. Keep it nice and simple. Good, nice, done.
Good. One last thing, guys. A quick show of hands. Raise your hands if you've already passed PLAB 2. Quick show of hands if you already passed PLAB 2. Or I'm assuming no one here has passed PLAB 2 and trying to get some extra teaching then. Okay, quick show of hands if you have passed PLAB 2 and you're looking for jobs. Okay, fine. So this probably won't be relevant so much in that case. When you guys have passed PLAB 2, we have jobs available on our Medic Flow platform. So it's like a jobs WhatsApp group platform where hospitals post jobs for locum doctors. And it may be very useful for you after you've passed PLAB 1 and PLAB 2. So just keep it at the back of your head. It's called Medic Flow. The website looks something like this, but it'll be something for the future. Obviously, you need to set PLAB 1 and PLAB 2. Okay, guys, do check out the PLAB 2 Advanced Communication Skills course. There's a limited time discount on it. And then secondly, also the PLAB 1 mock. If you've got your PLAB 1 mock exam coming up, please subscribe to that because it's a full day mock exam with like 6 hours of teaching on top of 3 hours of the mock. Super, super useful. Anything else you want to add to that, Vikas?
No, that's fine. So just let us know how you found the session. We'll leave it running for another 20 seconds for any feedback. Otherwise, hope you're all staying safe. Look after yourselves, obviously, during the pandemic. Work hard. And do get in touch with Inspire Medics if there's any questions you have about PLAB 1 or PLAB 2. We can see if there's anything that we've got that we can offer to try and support you to pass both of those exams.
So the next webinar, guys, will be in about 2 weeks' time. You will all get an email, a Zoom email, most likely, with the new link for the next webinar. Please do sign up for it. We'll be doing a new topic. And then, of course, check out the videos on the website for PLAB 2. Check out the notes. Check out the free question bank. And let your friends know, please, because the free PLAB 1 question bank took us about 3 years. And we haven't really got a big budget for marketing that. And it's really about word of mouth. So if you can promote it amongst your friends and colleagues, that'd be really, really useful. Even in your hospital mess, if you can put up a little leaflet or a banner of some sort or something, or just mention it to your colleagues, that would just really help us going forward. So take care, guys. It's a Sunday lunchtime now in the UK, coming up to 12. Me and Dr. Sando are going to head off very soon to have a quick bite to eat. Wherever you are in the world, thank you for joining us. And we will see you very soon. And a quick shout out to Shivanki. You're very welcome. And we'll see you soon as well. So take care, guys, and we'll speak soon.
That was, yeah, perfect. Bye-bye.